Good afternoon, Professor Weed. This is Brenda Lee Rouse, and this is my final project for our class, Community and Public Health. What is the role of community and public health in the well-being of our population? The role of community and public health is to help develop and monitor programs and policies that aid individuals and the general public in obtaining and maintaining optimal health and well-being. Some of the ways that these objectives are achieved are: monitor health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships and action to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services, and ensure that the provision of health care when otherwise unavailable, assure competent public and personal health care workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health care, health services, research for new insights and innovative solutions to health problems. The public health organization structure can be very complex and specific. It starts at the most local levels and then, depending on certain factors, including the severity of the situation, escalates up a management chain, possibly even being brought to the attention of the President of the United States. Any actions taken to address the needs of the community and public health may take the following path depending on the issues that need to be addressed: city, county, state, and federal organizations such as the CDC, the HRSA, FEMA, the NIH, FDA, and so on, up to the President of the United States of America. This is an organizational chart of the U.S. Department of Health and Human Services, which defines the way the organization is structured. Legal and ethical dimensions of public and community health services. Law in public health provides authority, limitations on state power, incentives and disincentives for behavior, and often allows for much professional discretion. It is a formal institution, which includes statutes, regulations, and court decisions. Public proceedings with a reasonable person standard are considered when making law according to health care and the community needs. Ethics in public health provide ongoing analysis, deliberation about, and justification for public health action and policy, often when law is indeterminate. It is a less formal institution. It's based on moral norms, professional codes, and previous cases. It's also based on publicly justifiable positions based on ethical reasoning. Where does the money come from? Funding of public and community health services are funded in a fairly convoluted and complicated process. The World Health Organization defines healthcare financing as, quote, function of a healthcare system concerned with the mobilization, accumulation, and allocation of money to cover the health needs of the people individually, collectively in the health system, close quote. Sources of revenue collection for healthcare funding come from multiple sources. Any funds for healthcare are collected in many ways from the general public, with the exclusion of donations, which are freely given to charities. Some of the ways healthcare revenue is collected are through taxation, social insurance, contributions, private insurance premiums, and out-of-pocket payments. The following slide shows a diagram of the way funds flow through the healthcare system. The important role of communication in community and public health programs. Good communication is critical in collecting data, processing information, determining and taking appropriate actions, and coordinating efforts between the multiple agencies that are associated with public health. Communication starts from the very basic element with the attention to the individual requiring treatment and ranges to the broad-reaching government and world organizations who administer the programs to benefit the individual, community, and general populations. In our textbook, Community and Public Health, we learn that communication first starts between an individual and their healthcare provider. Quote, health services for the patient or client are in part organized by the personal physician who directs health needs by weeding through a multitude of potential institutional and provider services. In some instances, coordination is managed through case management services and social assistant organizations, driven initially by insurance companies and public entities. Social services, in collaboration with physicians, provide a gatekeeping function for publicly funded programs and insurance companies. Close quote. Another important factor to consider is the individual's ability to be an active participant in communication that is necessary to meet their health care needs. This ability is known as health literacy. The National Institutes of Health, or the NIH, explain that health literacy, quote, health literacy, incorporates a range of abilities to read, comprehend, and analyze information, decode instructions, symbols, charts, and diagrams, weigh risks and benefits, and ultimately make decisions and take action. The concept of health literacy extends to the materials, environments, challenges specifically associated with disease prevention and health promotion. Close quote. Unfortunately, according to the National Institutes of Health, the necessary skills needed for individuals to be health literate are absent in a majority of the American population. It goes on to say that on the National Institute's Health website to clarify why this is a critical problem. Quote, this fact is more disturbing when one considers that these are the very skills and strategies that often lead to longer life, improved quality of life, reduction of both chronic disease and health disparities, as well as cost savings. Health literacy is estimated to cost $106 to $236 billion annually. Close quote. In summary, the role of community and public health is to help develop and monitor programs and policies that aid individuals and the general public in obtaining and maintaining optimal health and well-being. Community and public health encompasses many entities, some of which are government, law, healthcare, research, and assurance programs. It is a complex issue that requires many professionals from all of these fields to work together for the common good of the public health. Legal and ethical guidelines are adhered to in order to make sure that the needs and freedoms of individuals are weighed fairly against the needs of the general public in order to benefit the community as a whole. Funding for healthcare programs comes in many forms. Revenue is collected through taxation, social insurance contributions, private insurance premiums, and out-of-pocket payments. Funds also come from individual charitable donations. The value of good communication in all forms is crucial. Good communication between individuals and their healthcare providers is vital. Health literacy needs to be improved among the general populations in the U.S. in order to help the professionals in the community and public health organization to be more effective in handling issues that face the general public.